Well, hi, everyone. Welcome to the Familywood Podcast. I'm so excited for today to introduce you to today's guest, Dr. Martin Zach. Welcome to the podcast, Martin. Thanks for joining us.
Yeah, thanks for having me.
Yeah, really appreciate you taking time out of your busy life to do this and to share some of your profound knowledge. You're an expert of the space related to gambling disorder, which is something that is gaining more and more attention. Thankfully, it's gaining attention. Unthankfully, negatively, I guess, sadly, that it's needing attention because it's something that's so pervasive now and on the rise. We talk about today.
Yeah.
So before we begin, I normally like to start off with just learning a little bit about you, Martin. So you've got a heck of a background in the gambling space. Would you mind just walking our guests through your journey about where you've been, where you've gone, and what you're doing now?
Okay. Yeah. So right now I'm in Toronto working at the Center for Addiction and Mental Health and sort of got into the gambling field around almost 25 years ago now. So it's been a journey. Did my PhD at a university called Waterloo in Ontario, and it was a really great experience. So it was a very interactive, and I was fortunate to have as my supervisor somebody who was an expert on learning. And so she taught me the role of learning in addiction, which of course sowed the seeds perfectly for gambling. Because at the time, everybody was thinking, you know, drugs disturb the brain, and learning is, well, don't worry about it. But, maybe there's something going on there,
The
but don't worry
chemical
about it.
function of the drug is to blame, not the learning behavioral
Precisely,
aspect.
precisely. So in terms of my preparation to sort of delve into this area, couldn't have been better. I was really fortunate. And then, of course, there was the change in policy that liberalized gambling from sort of something that happened in Vegas or New Jersey to something that happened everywhere. And then, of course, there was a demand for research because catching up was huge in terms of relative to other addictive disorders. And then there was the whole debate: is it an addiction? So we're closer now to having the evidence, but it's been a very steep ascent in terms of the learning and the sort of acquiring knowledge. But I'm really grateful to have had that opportunity to sort of be in at the ground floor and working with some wonderful folks here at CAMH in Toronto. So that's my short
Yeah.
compressed story.
Right on, right on. And CAMH is doing some amazing things. So, and we'll talk about them later. So you're also at U of T. Uh, you're the psychopharmacology guy.
They've got me teaching neuropsychopharmacology. So there's an extra two syllables added in case you needed it, to sort of zero in on precisely what the topic area is. But I really enjoy it. It's another whole aspect of it, sort of interacting with the students and sort of remaining sort of engaged beyond the virtual and beyond the numeric scholarly realm. Yeah.
So for the viewers, I remember sitting in a class of Dr. Zach's and learning about the relationship or the mechanism of ethanol, alcohol, and its relationship to MSG and how that interacts with toxicology. And I still wonder, and I'd love to do a study. I still wonder if ethanol and MSG have a role to play, then how do Caesars, in Canadian, we drink these drinks called Caesars with Clamato, which viewers may or may not know is full of MSG. So how does MSG and a vodka Caesar, how do those two compounds interact with each other and affect toxicology? You've taught me that, and I still wonder that to this day.
No, no, it's a great question. I mean, endless questions, but yeah, that's a good one.
Yeah. You've got a fairly major study you're involved in now. Tell us about your role and what this current study is.
Okay, so briefly, there's a lot of debate as to whether it's useful to use medication to treat gambling disorder, a lot of people don't think of it as a brain syndrome. So once you get sort of out of that brain mode, you think medication, what's the role? But I think of it more like depression. You know, you think about how much of depression is really caused by our day to day experience, things like repeated exposure to stress. And so when you think about that, you think about what happens when we gamble. And basically, people are exposing themselves to opportunities for reward, but never know. And so basically, your brain is being stressed. It just so happens that the opportunity for winning something kind of buffers that, but you're being stressed the whole time. And so, not surprisingly, things happen to your brain much as they would if you're chronically exposed to stress and develop depression. So I kind of look at it from that side. We're using a medication that is used for people with early stages of Alzheimer's, early to mid stages of Alzheimer's. And the idea there is that part of their challenge is they're very rigid. Their mental set is very rigid. They can't accommodate new ideas. And so what this drug seems to do is to help them not only think more clearly, but also if they're following a path that is not productive, to learn from their mistakes and also to feel emotionally like they can disengage. The idea is that they don't feel locked in and that they're capable of making that mental shift and not sort of feeling, what's the word? Almost apologetic. You know, you get locked into a mode and you sort of then everything becomes, is this guy going to keep going or is he going to step away from it? And that becomes a real push pull. So the drug seems to create this flexibility where the person feels, okay, I've had enough here. I'm walking away.
That for the viewers that may be curious what this looks like, it's theatrical. However, there's a really good movie on this. Martin, what's the movie with the CIBC banker?
Is it The Gambler?
Yeah, CIBC banker
It's just called The
gambling.
Gambler, isn't it?
No, no. Owning Mahoney.
Owning Mahoney. Okay, different one.
Owning
Yeah.
Mahoney to the viewers that are interested in seeing what gambling disorder looks like in action. Owning Mahoney. And it is a behavioral representation of what you're talking about, Martin, that
Okay.
zone.
Interesting. Okay, good to know. I'll have to
Yeah.
rewatch that one.
It's been a couple of years for me too. It's really
Yeah.
hard to watch. It's not an uplifting movie for anyone that goes to watch
Yeah.
it, I warn you.
Yeah.
Yeah. So you got this is a fairly major study you're doing right now, from my understanding.
It's major in terms of the amount of legwork involved, but in terms of the scope of the study, maybe this is true for all sort of all kinds of research. It's called a feasibility study or um, a proof of concept. So the idea is to take some data that have been promising and to see if you can actually test the hypothesis or the idea that the medication is helpful in a way that brings people into the clinic in a way that controls for possible effects of placebo effects, which are pretty big in the case of gambling, and to see if we can retain them in the studies, because one of the big problems is they drop out. So they
Attrition.
go halfway through its 10-week trial and they get to week 5 and either it's not working or I'm all good or whatever, you know. So basically they've got more important things to do and they're gone. So we want to see if the benefit of this treatment is sufficient to keep them engaged.
Yeah. Yeah. Um, so you're looking at what's the name of the drug?
It's called Memantine.
Memantine.
That's the generic name for it.
Yeah. And so you're looking at memantine and uh, how it relates to the ability to be more adaptable and flexible.
Exactly.
Yeah.
Exactly.
So for the viewers that are looking to understand what a person with gambling is experiencing, would you mind helping describe what that rigidity looks like in terms of somebody with gambling
Yeah.
disorder?
Okay. So it's It's a great question. So the one of the symptoms of gambling disorder that is unique to this form of addiction is something called chasing. And so in the case of chasing, a person has incurred a lot of debt. I'll think of a slot machine. So they've spent pretty much everything they brought with them, and now they're taking trips to the ABM and, basically topping up their credits, and they're basically spending what they don't have to spend. But the thinking is that eventually, if I continue at this game, I will hit the jackpot and erase all of the losses I've incurred to that point. So this is a kind of distortion that exists, but it's reinforced by a subjective experience that happens as the game goes on. So you get little tidbits of reward that is, by design from the slot machine saying, you're getting closer.
Even the card games too, Martin. Like I'm thinking
Sure.
like on a blackjack, like flop or whatever, I don't know what it's called. You get a 19 and the dealer shows a 7, like
Yeah.
there's a little
Yeah.
hit, right? Yeah.
That's right. So all along the way, the person who's gambling is getting little prompts or cues to say, you're getting closer, you're on the right track. And so all of this evidence is being sort of synthesized in the brain of the person, much of it without their full awareness. And it contributes to this sense that I must continue. And so even if somebody says, broke guy, give it up. It's time to leave. There's a sense of compulsion that if I leave, the very next trial is going to be the winner because that machine's going to pay out and that's all my money in that machine. So there's a compulsive aspect to this where the person is at some level they're aware that each trial is independent, but at the level of subjective experience, they're locked in. They can't leave because they've made their huge investment. And furthermore, all of their internal signals are saying, I'm due, I'm going to win. I can feel it, right? And so the idea is to somehow facilitate these individuals' ability to sort of step back, get some perspective, and say, all right, I've lost something. I realize that, but I know sort of in my cool mindset that I could just walk away now and the damage won't be that bad. Or I can just continue. And so if you don't have that moment of objectivity, then you persist in this chasing, and that's where this huge debt is built up, spending money you don't have.
I was thinking about this morning, I was thinking about what I hope the viewer takes away from this. And so for the general clinician that may be watching, for the therapist that supports addiction, or for the family that has a loved one with addiction, and we've worked with quite a few of those. We can talk about that. For those people, I hope they're coming away with a greater empathy, a greater understanding that this is very complex, and particularly once in so I see gambling as like two phases. There's the decision to gamble, drive to and walk into the casino, like that's one thing. But once inside, or once the app is open, there are forces working against this person that are far more powerful than than society gives credit to.
Absolutely. Absolutely.
Yeah.
Um, if I can just jump
Yeah,
in
sure.
there. So
Please.
the basic idea is that people have called gambling the pure addiction because there's no drug. So what is it? The common essence of all addictive substances or activities, it's dopamine. It's this chemical in the brain. And it does a lot of important things that include ensuring our survival. So we get signals that tell us where something is, a reward, for example. But from the standpoint of a sort of common knowledge, people may be aware that elevated dopamine is the hallmark of people with schizophrenia. So when you have schizophrenia, can't make sense of the real world. You cannot distinguish fact from fantasy. And so that dopaminergic component. It's strange because it's plausible. So, for example, a person with schizophrenia may see a parked police car at the corner, and for most of us, we'd say something's going on, the cops are doing something. But for a person with schizophrenia, the dopamine system is hyperactive, and they are in a mode where they say, "Uh-oh, they're coming for me." And so in a whole elaborate, first of all, it's highly egocentric, that's right. And also it is an elaborate set of associations that is very overwhelming. So the person cannot deny what their thoughts are telling them. They can't sort of step back and say, "This is not true. This is just it's just a police car, and I'm not in specific danger of being arrested." But they can't do that. Their ability to distinguish reality from their own distorted perception is compromised because their dopamine system is overactive. The same the same process is at work when a person is gambling, as you said, in the situation. When they're outside the situation, the phone is off, there's no app going, or they're not in the casino, they're basically able to talk with you at the table and have a very logical, reasonable conversation. But because they have engaged in gambling for many months, years often, the dopamine system has adapted. And so now all the same prompts and cues that would be of interest, of, make things pleasurable, the lights go off, the bells go on, all that stuff now has become like a siren song. They are locked in. They cannot ignore it, literally. And so the siren song says that anybody who hears the song will perish at the hands of this. The voice is too beautiful to deny. And the same is true. They're getting this song that tells them, here is exactly what you want. Just keep at it. Just go there. And so the inability to extricate yourself from that overwhelming feeling of, here it is, this is exactly what I'm looking for, is almost like the disturbance in people with schizophrenia who have beliefs that are irrefutable to them.
Yeah. Okay. Um, Another phenomenon that I'd love to hear you talk about, Martin, the concept of chasing the loss. We, I say we in general as society often think, and which is true, that the gambler is chasing the win. It's the win that they want. And we have some evidence that suggests the loss is actually the mechanism that is driving the behavior. Talk a little bit about the loss, and I think that's a good segue, which we'll go into after to this week's article spotlight.
Okay. So normally, when a person has a bad experience, it's a natural form of punishment. It tells the person, what you just did, that was not the right thing to do. Don't do it again. And
So the normal person goes into a
the
casino,
healthy person.
loses $200 or whatever they budgeted, and they feel sad, shame,
Yeah,
guilt, whatever
yeah,
they like,
they
yeah,
feel bad.
depressed, and they walk away.
Right. Yeah.
The
I think
gambler,
that's yeah. So I think the idea is that first of all, you have to be able to properly process that. You have to be able to incorporate that in a way that's accurate. So I think feeling ashamed or feeling guilty or feeling silly or stupid, these are the feelings that are very unpleasant and would normally stop the person from continuing in that behavior. But it depends on the person's how you interpret those unpleasant feelings. It's possible, and is often the case, that over the course of one's gambling career, you begin to reinterpret these events in ways that make sense with your own, let's call it delusion. If extend the kind of metaphor with schizophrenia, the delusion is that all of these experiences are all signals to you as to how you should proceed. And so If you are losing or you have incurred a lot of debt, it means that it's about to pay off. So that all of the things that would normally tell the person without gambling disorder, walk away, are reinterpreted in ways that
Getting closer.
actually turn the behavior around. The most succinct description I ever heard of this was problem gambling is bizarre because both winning and losing are reinforcing. Both of them make you want to go back and keep going if you're a problem gambler.
There's the complex, like, I shouldn't laugh, but
Yeah.
there's the
So
complexity of
unfortunately,
gambling. It's so hard
these
to
folks
treat.
are. Does it make sense?
Importance of your work, yeah. Um, and so some of those ways that the loss is reinforced,
Hmm.
we talked about in a paper that we co-authored. So I'll
Yeah.
I'll take the viewers to our weekly segment where we talk about an article related to addiction and have some banter. So this week I chose the article that we co-authored a couple of years ago with Dr. Luke.
Luke Clark.
Yeah. The paper will be linked in the description. It's dopaminergic signaling of uncertainty and the etiology of gambling addiction. So in this article, we explored a new model for why gambling can become so addictive. The core idea is that it's not the wins that hook people, it's the uncertainty. Our brains hate and love, particularly some people really love
Yeah.
uncertainty. We don't like to acknowledge it, however. So when a game doesn't always pay off, our dopamine system, the reward chemical, stays on edge. It reacts not just when we win, but during the suspense of potentially winning.
Hmm.
As you talked about, Martin, in this article, we explored the back and forth of uncertainty, wins and losses, and how that
Hmm.
can sensitize the brain's reward circuit,
Hmm.
making gambling cues more and more irresistible. Gambling cues, we'll talk about that.
Hmm.
Yeah. So in effect, the games become a kind of magnet for attention and desire, that dopamine, craving. Modern slot machines and electronic gambling games, gosh, what a new phenomenon this has been. Online gambling are especially powerful here. They speed up the play.
Hmm.
They create, because they can use technology, a lot of near misses
Hmm.
and even disguise losses as wins. Losses disguised as a win. All these features amplify uncertainty, which is the argument of the article, that gambling is related to uncertainty. That's the mechanism at play. And that keeps the dopamine system firing. In short, this article talks about how gambling's addictive pull comes from a regular rewards, but from the tension, really, like you said, Martin, that maybe I'll win.
Hmm.
And over time, the brain gets rewired to chase that feeling. The person with problematic gambling is chasing that I might win,
Hmm.
doing those odds calculations and chasing that dopamine. So, Martin, describe for the viewer, please, on a slot machine or on online
Yeah.
gambling, what's a loss disguised as a win?
Okay, so oftentimes we make a certain wager, let's say it's 20 credits on a slot machine. The win or the apparent win may be 10 credits. So we've expended 20 credits, we get 10 credits back, and the 10 credits are perceived to be a win because there's a lot of other sensory cues that come in. You hear bells, you see lights, you may hear a siren, other things that tell you that you have won. So what is obscured is the fact that you bet 20 and you got 10. So if you then take that model and you say, I have a variety of ways to make my wager. I can have a different number of lines on a slot machine. I can bet a certain number of credits per line. I can choose different configurations. And oftentimes, so in that process, we may come up with a wager that is 50 or 100 credits, and we may come back with 80 as the win or the payoff. And this process is ongoing periodically. About half of the time you win something, and half of the time it's quiet. There's no answer whatsoever. So the very fact that there is a positive outcome, an outcome that is indicative of some success, is perceived as success. So in the noise of uncertainty, the highly salient events like the bells and the lights and the sirens are what is encoded, what the brain makes sense of and says, okay, the fact that I spent 100 and got 80 is less of the issue. As the person is processing it, what they're getting is more and more dopamine signal telling them that they have won. So all of the factors that tell dopamine under natural conditions, this is an important event. Lights, sirens, bells, these are the sensory signals to the dopamine system. Pay attention. And so
And
you are paying attention.
logically, the gambler lost, but the brain's dopamine system interprets it as a win.
Precisely. Yeah. Couldn't have said it better. So that's exactly right. So, and that pattern repeats itself dozens and dozens of times over the course of any game or, especially on a slot machine. So I think the fact that you're waiting for something, the fact that you are in an anticipatory mode all the time, that when something comes as opposed to nothing, because that's very aversive. When nothing comes, that's not a pleasant state. But when something comes, it's like really doesn't really matter the reward so much as the dance around the reward. It's a kind of a celebration of something good happening. And that is how it's processed by the brain's dopamine system. The money almost blurs away. So the outcomes are important because they feed the expectation. The expectation is, as you said a moment ago, what really drives it. It's the hope for a win rather than whether or not you win it actually in terms of the dollars and cents.
Yeah, good interpretation, Martin. So another weekly segment we do that I'll transition to here is we do a spotlight on an organization related to addiction. Just given your post at CAMH, I thought that CAMH should be a good one this week. So before we dive in, I'll introduce the viewers to CAMH, the Center for Addiction and Mental Health, based in Toronto and is Canada's largest mental health teaching hospital. It's large. I don't know if anyone's ever seen a map of just how many buildings and the size of the complex. It's also one of the world's leading research centers in the field of addiction and mental health. What makes CAMH unique is the way it brings together clinical care and cutting edge research and education. And it's all under one roof. They don't just treat patients, they also train the next generations of clinicians and researchers and pushing our understanding of mental health and addiction to the next level. For families, CAMH is really a place of hope. It's where groundbreaking discoveries are being made about how the brain works. Discoveries like Dr. Zach is talking about here today, and why people struggle with things like substance use and gambling. And more importantly, how recovery can be supported. Martin, I really appreciate that you're now like seemingly in this stage of your career, and the research is now at the stage where we're now taking our fundamental understanding of it and we're now researching ways to support it, recover it. And you're working on that pilot project with that drug. So yeah, Martin, tell us a little bit about CAMH.
So as I said at the outset, I'm really fortunate to have gotten my spot there because it's highly interactive. Everybody who's sort of in the medical zone of things, sort of the psychiatric, is familiar with and encouraged to interact with people who are in the psychosocial end of things, people who are at the level of public health and public policy. So it's a highly integrated system, and it's It's everybody. So it's the collective contributions of folks who are really making the benefits for the people who have these syndromes or who may be at risk for having these kinds of disorders. I think one of the things that is really good is we're recognizing the importance of prevention. So it's very, very important. So for the longest time, even mental illness was treated largely after the fact. But now that we have good insights into what are the predictors of these syndromes, it's possible to identify folks who are at risk. And so I think the idea is to begin to disseminate this information in ways that will help detect people who are at risk for these kinds of challenging disorders like gambling disorder, for example, before they get locked into it, because the adage, an ounce of prevention worth a pound of, it couldn't be more true. In the largely be And I'll just briefly say this, because in the case of addiction, and gambling is true of this as well, participation in the game or exposure to the drug changes the brain. And what you're trying to do when you treat it is essentially undo that pathology, that change. And that's a whole other layer. So if you can get to a young person, adolescents even, before they've gotten to the point where there are problems, that is a real win, in the sense, no pun intended, but it's a win for everybody, because the likelihood of these pathologies becoming ingrained in the person's brain is greatly reduced.
You say that, Martin, and I wonder. So I'm thinking about. I know this is true for substances, for chemicals, drugs, and alcohol. That the age of onset is an incredibly strong predictor of future problematic substance use. So strong, in fact, that the argument is often made that one thing parents need to just do is do everything they can to delay that first administration
Yep.
to the point where the frontal lobe is developed. And that will help prevent substance use issues down the road, because early onset is such a strong predictor of future use. I wonder if the same is true for gambling.
I think the evidence is pretty strong, yeah, that that's also the case, particularly in boys. But the basic notion is
The
this: that
impulsivity.
there are two critical periods of learning when the brain is, in a sense, like a sponge. It's ready to learn and acquire new lessons about the world, and these in turn provide the context for all future behavior. The first is right after birth. Second is in adolescence. So the critical period is the window before the brain has sort of consolidated into networks that are going to, this is my new career, this is my career, or this is my new spouse, or what have you. Those things are consolidated around the middle of the 20s. But in the teenage years especially, it's highly malleable, and it's predisposed to respond to rewards, as you might imagine, and to take risks, because that's how you learn to some extent. So one of the things, of course, is that young people, especially men, boys rather, very interested in the opposite, or finding a partner for some form of connection, relationships. And what we're beginning to see is that those same networks that mediate relationships and the connection with other people are being co-opted. They are being engaged by gambling activity, because it turns out that the same parts of the brain that signal to the person, wow, I'm having a great connection with this person, are the ones that say, you're going to win, man. This is great. You're a winner. And so
There's
you're
a sense of
literally.
connection that comes from being in the game.
Precisely. Yeah. The experience of it leads to changes in the hardware that translate into a, a, a distorted perception of likelihood of winning. So some of these cognitive distortions that we talked about, how
Because likelihood of finding a mate is the
risk,
same neural
absolutely.
mechanism
Yeah.
of likelihood of win or similar mechanism.
Yeah. So basically this attunement to the reward and the system that really goes, think of your first kiss and think of all of these, it just goes off the charts. And the same is true when kids have their first win.
Martin, man, I think about people, we can all, most of us, recall our first kiss or our first sexual experience, like those primitive kind of markers of life. I wonder, yeah, like, and I'm thinking about gamblers, all gamblers. I'm going to say all, that is so
Mm,
concrete, but all gamblers can recall those big wins and appear to have the same emotional energy when they're sharing those wins. They have the same emotional energy maybe as somebody who's sharing that first kiss
right.
story too.
Yeah, of course. And that's what sets the high watermark because rarely are you ever going to be able to reattain it. It's the first time. How does one ever get back to that? You can't. So you're always measuring it against the first real wow moment in your life, however it was defined. And if you've got a person, it's not exclusive to gambling, but gambling certainly does a good job of it. That so all I'm saying here is that think of this in the context of it's a neurodevelopmental syndrome, and it happens in the context of family factors, role models, communication. There's a lot of shame in gambling, by the way, as you well know. I guess I'm not telling you anything you don't know, but this whole idea that things, especially when you're supposed to be responsible. And so it really goes against being responsible. So the things that you're saving or the things that you're sort of planning for in the future often go out the window for reasons that aren't entirely clear even to the person who's losing them. So it goes underground. And so young people may not divulge to their parents that they're engaging in gambling. It's still illegal if you're under 19 in Ontario, and other kinds of activities that you can hide because there's nothing on your breath. And even the time that you're spending in your room, you could just say, oh, I'm just watching videos. And how would they know? So the basic point is that the ability to hide this behavior is a part of what could contribute to it escalating to a level that becomes a problem even without the awareness of those around the person. And so it's really important to have these conversations and not punitive, but to try to understand it from the point of view of a young person who is looking for excitement, who is looking for and is probably more risk prone because that's what the brain wants us to do is try new things. So uh so it's not abnormal to want to try these things. What needs to be understood is that without the adequate information about the consequences, then it all looks like, isn't this going to be wonderful? And I think the industry is designed in part to make that message salient to the potentially gambler.
Of course, of course. Yeah, well, like look at the image that Vegas has invested so much in of excitement and glamour and luxury and winning. Winning. Yeah, winning.
Winning, yeah, that's
Yeah.
Charlie
Um
Sheen's favorite
I
word.
I know you're deeply in the world of research. However, from a clinical perspective, what would you say to the parent or the spouse or the child? What would you say to the family that's affected by somebody with gambling disorder? What do you think they should know about that person?
Uh, so my first thought is that a lot of problems around addiction are naive. They come from naivete. So, and the unfortunate thing is that once you get involved, you're almost more motivated to hide things and to profess knowledge that you really don't have. So, I think it's really important to have conversations that are honest, say, and encourage sort of what would I call it? A kind of dialogue that is maybe trading experiences, recollecting how things were. Did you ever gamble or did you ever have experiences where, you got burned or something else happened, and sort of have that kind of trying to bridge. I guess that's the word. I would
And
hope.
what a staple in kind of all healthy relationships. Like nothing rocket science there. Open, healthy dialogue.
Yeah, I think so.
Yeah, empathetic
I
conversation.
think that's kind of where I'm coming from. If I could say one word, is to emphasize empathy. I think what happened during COVID is a classic. It's a real world experiment of how bad things got, because the capacity to share with other people was blocked off. People were isolated, and gambling and all addictive disorders rates went through the roof during COVID. We're meant to be connected with others, but the connection, the value of that connection comes from the shared experience that is hopefully frank and honest. So a frank and honest kind of exchange. Yeah.
And from an empathetic perspective, we all have experiences where we've taken risk and lost.
Yeah.
We've all had an experience where we chased something.
Yeah.
Yeah.
That's true.
What I hope the family members take from this is that there's serious psychology at play here, and these gaming companies, these slot machine companies, even the tables, like the way that they set up baccarat now with the screens and roulette, like there's screens at the tables now. So for a family member that hasn't been to a casino and has a loved one with gambling disorder, there's psychologists that are employed by these companies that are designed to trap your loved one
Yeah.
and to suck as much money, despite the problem, out of that loved one. And even the messaging from our government, from, know your limit, play within it. They're still saying play within it, right? Like I think back
Oh,
to one of my old academic mentors, Dr. Marvin Crank, who had a big personal beef. Speaking of learning, one of the learning guys, he was the rat experiment, one of the famous rat experiment guys. Anyways, Dr. Crank had a big issue with drink safely, like
yeah,
these
yeah.
messages that come from the government that
Sure.
implicitly imply, yes, do it.
Yeah,
Yeah.
that's
And if
right.
it was so easy just to do it safely or play within our limit, then we wouldn't have CAMH with wonderful researchers like
Yeah.
you, Dr. Zach. My last question. Actually, I have two more questions. Maybe we can tie them in together. How important is it for somebody how important is it for a family member who has a loved one affected by gambling disorder to get specialized support?
That's a great question. I think the short answer is it's vital. And I think part of the problem is that in the vast zone, addictions, it's like you have psychiatric disorders. You might have a specialist who deals with depression. You might have someone who deals with schizophrenia. But oftentimes you have people who just deal with addictions. There are, as much as the process level, there are common elements, the syndrome. It's very, very important that somebody with expertise understanding the psychology that you describe. For example, no other syndrome is faced with trying to explain the concept of losses disguised as wins. So that is something built in to the problem that person needs to learn about, and to understand that they're, in a sense, being fooled. The role of chasing as a fundamental distortion. These are things that are unique to gambling. And the other issues that I mentioned or alluded to was this idea that you can seemingly be fine until you're profoundly unwell. Exactly. And so
And
that,
and once it comes out of the woodwork is typically, and that's often true of all addictions. Like
yes, but
once the
you,
magnifying glass goes onto it, then it,
yeah,
yeah.
I think that's true, but I think there's almost always hints beforehand in the case of alcohol or weed or any other where there's a substance. But
Well,
gambling, not
at
so much.
Familywood, we specialize in working with the families, and a universal theme in our work with the families is affect related to missing the cues and not trusting their gut. Universally, every family member can recall warning signs that they chose to ignore.
That's fascinating.
Yeah. Um, uh, well, Martin, Dr. Zach, thank you for joining us today. Really appreciate you sharing some knowledge. To our viewers, I hope you've gained some valuable insight into the complexities of gambling disorder. It's been a bit of a side passion of mine. I'm so grateful to be able to have shared this with you, Dr. Zach Martin. Thank you so much. Thank you for all the work that you do too. It's so important. Gosh, it's so important. One of your colleagues from CAMH did a piece on CBC the other day talking about the rise of problematic gambling, talking about the rise of problematic online gambling in youth.
Mm-hmm.
Man, we thought youth have issues with Instagram.
Mm-hmm.
Yeah, we haven't seen anything. And when those youth become older, this is scary.
Yeah.
Online, I won't sugarcoat it. I'm very
Uh,
concerned about online gambling, and
yeah.
we won't go into politics, but it sickens me to think about how much our government is involved. Yeah.
So it's important to
That's a
find better
separate
ways.
podcast, Martin. Enjoy
All
the day.
right.
Thank you.
Thank